Namaskar दोस्तों, good evening. I am Purnima from Fertility Dost. Once again, I welcome you to this very special session related to embryos. Whenever we talk about fertility journey or we discuss about IVF, then the first thing that just strike us is embryos. And nowadays we just talk about embryo grading. आई डोंट नो हमें कितना पता है इस बारे में कितना नहीं बट वेन एवर वी डिस्कस अबाउट द फेलियर्स और सक्सेस स्टोरीज द फर्स्ट थिंग वी डिस्कस अबाउट ओ I had blastocyst transfer. Oh, my embryos are not good. They are just 3AB or they are 5AA. Then also it failed. So to know more about this, I don't know whether you all are mainly considering these grading for your success or not. But yes, there's something happening inside the IVF lab. So first, we just discuss about the things. We just talk about the doctors. We just talk about the stimulation point. But nowadays, it is really important to know about your embryos. So when we talk about embryos, it is really important to visit, or we can say that deep penetrate inside the embryo lab. So today we thought, चलिए बात आज एम्ब्रियोज की ही कर लेते हैं. Why not? We talked about AMH values, we talk about low AMH है, एज के साथ कम हो रहा है, डोनर साइकिल पे जाइए, या स्पर्म का इश्यूज है, कुछ तो पैरामीटर गड़बड़ है. बट जब हमारा एक फर्स्ट पार्ट of the story is complete, that means we are through with the stimulation part and we have our embryos with us. Now what next? Do these embryos are really viable to give us pregnancy? And the interesting part is about day 3 and day 5. So we'll discuss all important pointers related to embryos. So we choose a topic that is what happens inside the IVF lab. ऐसे लग रहा है किसी बहुत एकदम स्टोरी में घुसने जा रहे हैं आज हम. सो पीपल प्लीज बी रेडी. जस्ट स्टार्ट पोरिंग योर क्वेश्चंस, योर सजेशंस. अगर आपको लगता है कि हम कहीं आपको कुछ इंफॉर्मेशन देने में रह गए, देन वी ऑब्वियसली वांट योर सजेशन ऑन दिस पार्ट. एंड इवन जो भी छोटे से डाउट्स आपके दिमाग में है एंड आपको लगता है कि व्हेन यू विजिट योर डॉक्टर इट्स अ स्मॉल थिंग, अरे हम डॉक्टर से इतनी छोटी बात कैसे पूछेंगे, तो आज आप वो सब हमसे पूछिए. एंड वी हैव अ वेरी स्वीट एंड नोन embryologist from Mumbai, Feni, with us. So let me add Feni to the main screen, and viewers, please don't forget to ask queries. And for this special session, we have ART Fertility Clinic as our knowledge partner. Namaskar, Feni. Good evening, and welcome to Fertility Dost.
Namaskar. Good evening. Thank you so much.
So, viewers, today we have Feni with us, and she is a very known senior clinical embryologist with ART Fertility Clinic, Mumbai. So, अगर कुछ भी आपको लगता है कि डॉक्टर ने कुछ गड़बड़ कर दिया या आपको पता ही नहीं चला एम्ब्रियोज कैसे थे, तो आज आप जरूर पूछ लीजिएगा. We'll discuss about the things that, as the main topic is what happens inside the IVF lab, and so tell you more about Feni. She has special interest in fertility preservation. That is really a very hot topic nowadays, and non-invasive genetics testing of embryos. And this genetic testing is really my topic. I really want to know more about this, Feni. So we'll definitely discuss this.
For
And
sure.
she has masters the skills of pertaining the oocytes freezing and embryo biopsy. And embryo biopsy, again, it's really very important nowadays. So let's start with the session. And first, सबसे जरूरी सवाल या यूं कहिए कि बहुत ही important question. What exactly do we need to know about the embryos when we are talking about day 3 and day 5? और एक जरूरी यहाँ पे ये चीज कि वेन एवर वी वेंट फॉर स्ट्यूमुलेशन और एग रिट्रीवल पार्ट, तो यूजली आज ही रिट्रीवल के बाद हमारे दिमाग में डाउट आने लगता है कि इज इट अ डे 0 or day 1, or how do I count the multiplication of my embryo cells? So how is this whole multiplication or this grading is important in relation to day 3 and day 5?
Sure. So first, let's start talking about how the development of these embryos happen after egg retrieval. So egg retrieval is usually your day zero. That's the day that we have retrieved the oocytes, and then we fertilize the oocytes with the sperms. Now, there are two ways that fertilization is achieved in an IVF lab. One is your conventional IVF, wherein we just mix the eggs and the sperms together in a petri dish and we let the natural selection happen. The other is called intracytoplasmic sperm injection, where we actually manually inject each sperm inside the oocyte. So this is all done on day zero. Now, 17 to 19 hours post this conventional IVF or ICSI is when we check if the oocyte has actually fertilized or the egg has fertilized.
Okay.
Once these eggs are fertilized, then these are known as embryos. Now, there are different developmental stages that an embryo goes through. Like you said, that we have to, make a decision either on day 3 or day 5. So, your day 1 will be your fertilization. Then, day 2, usually we don't check the embryos, they are still lying in the incubator. Then day 3, again, we check the embryos. On day 3, what we expect to see is that the embryo should be anywhere between 6 to 8 cells. Then it said, okay, this embryo is developing normally, as it should.
Okay.
Then again, on day 4, we don't check the embryos. And then we check them on day 5. Now, on day 5, these embryos are known as blastocyst. So they reach a particular stage, which is known as the blastocyst stage. And now there is this huge debate whether to do a transfer on day 3 or day 5.
Right.
And if you ask me, what scientifically indicates is that we should do transfers on day 5 because
Okay.
in a natural pregnancy, what happens is when the embryo has reached the uterus for implantation, it is in this blastocyst stage of development. So in
Okay.
IVF, what we are trying to do, we are trying to mimic what happens naturally. Correct.
Right.
So if we want to mimic it correctly, then it's better to do a transfer on day 5 when the embryo has reached blastocyst stage. Because
Mm-hmm.
now implantation is a very complex process. It involves a crosstalk between the embryo and your uterus. So both need to be at the right stage for implantation to occur. So for us to reach that right stage, it's always better to transfer embryos at the blastocyst stage. Now we talk about grading the embryos. So
Right.
when it's blastocyst stage, there are three different things that we consider when we are grading that embryo. One is the expansion of that embryo, how expanded that embryo is. And
Okay.
the other two parameters are based on the two cell lines that are present in the blastocyst. Now, there are two different cells. One is known as the inner cell mass, and
Hmm.
one is the trophectoderm cells. Now, to say it in simple language, the inner cell mass actually forms the fetus or the baby, and the
Hmm.
trophectoderm cells will form the placenta.
Okay.
So basically, we are trying to see the health of these two cells which are present in the blastocyst or the embryo. And then we decide, okay, this is like a 4AA. So basically, that 4 stands for the expansion. It can be anywhere between 1 to
Hmm.
6, 6 being the most expanded one. And then you have the two grades. So 4AA means 4 is the expansion, and A,
Hmm.
the first A stands for the ICM, which is the inner cell mass, which will form the
Hmm.
baby. And the
Hmm.
second A stands for the trophectoderm cells, which will form the placenta.
Yes.
So that's how we grade the embryos.
Okay.
So
Right.
scientifically saying we should always do a transfer on day 5.
Day 5. Okay. So next time when your doctor just mentioned the grading that yes, it's 5BB, so don't worry. You are doing the right thing. तो चलेगा.
Correct.
ट्रांसफर कर सकते हैं.
Huh.
So I think this is like a common thing day 5 transfer nowadays because maybe around 8 or 9 years back, the transfer was only done day 3. Because when I was undergoing my IVF, so कभी ऐसा नहीं था कि डॉक्टर ने बोला we'll freeze it and just come next month. It's like fresh transfer in day 3. So after so many years, we came to know, oh, day 5 भी हो सकता था.
Yeah.
So maybe it's because of freezing thing or some other advances in this whole process.
So basically, I feel where we were, say, 10 years ago and where we are today are two very different places, right? And
Right.
now over 9 million babies have been born through IVF, but it's still a very young science. So with every day, we are learning something new. So first we thought, okay, we can culture embryos only till day 3 in the laboratory, the kind of
Right.
environment we are providing. Then there were a lot more advances in culture media and how to culture embryos inside the lab, through which we then realized, okay, now we can go a step further. We don't have to stop at day 3, we can go till blastocyst stage. And even today, it depends from lab to lab. It's not that all labs are very comfortable going till blastocyst transfers,
Oh,
because you first check and see what's working in your lab, what's not working in your lab. So with advances, we have reached this position now where we say, okay, blastocyst transfers are better. We always knew that this is the stage that the embryo implants naturally, but we were trying to mimic that in the laboratory, and now we are confident that, okay, we can do this. And regarding freezing of embryos, it's not that every time you have to freeze the embryos. Suppose
mm,
you have done an IVF cycle now, we have collected the eggs, and then it depends if the woman's uterus is conducive in this cycle to receive the embryo. If the doctor will check the hormones and they will check the lining of the endometrium, and then they will decide that, okay, say if in this cycle the uterus is not conducive for
mm,
implantation, then better that on day 5 whatever embryos we have, we freeze them, then they come back for another cycle. Because see, now once you have stimulated the ovaries, you don't have exact control of how the hormones will be after that.
right.
And when you do that in a frozen embryo transfer, you can completely control the profile of all the hormones. So in some
Right.
cases, it's better to do a frozen embryo transfer, but it always depends from case to case. There is no blanket answer that this is better and that is
Mhm.
better. It depends how that case works.
Right. So we can say let your doctor decide for
Correct.
you that which day transfer is possible or viable, and whether it should be fresh or frozen.
Correct.
So Feli, one thing which we have many queries related to this, that my doctor freezes my embryos at day 3, then they just thaw it, and they just put embryo to grow for another few hours, and then they transfer day 5. So is this thing a viable, or we should always yeah, doctor should always freeze that embryo at day 5 only?
See, now, if we are going to freeze embryos on day 3 and then
Hmm.
thaw them and wait till day 5, then, in my opinion, might as well do that in the first go. When you are
Right.
culturing the embryos,
Hmm.
पहले ही उसको डे 5 तक ले जाओ, because I will tell you one more thing. So on day 3, suppose you have 6, say, good embryos that you can freeze. Now, not all of them will reach the blastocyst stage, right? Maybe
Hmm.
2 have reached or 3 have reached. So freezing embryos on day 3, you will incur the cost of freezing. You will freeze all of them, and then हो
Right.
सकता है कि उसमें से खाली 2 या 3 ही ब्लास्टोसिस्ट बने. तो इससे बेटर है कि हम वो पहले ही पता कर ले कि किसमें ब्लास्टोसिस्ट बनने का पोटेंशियल है, and then we freeze only the embryos which have reached the blastocyst stage.
Blast.
That will save the patient also a lot of cost, and ultimately we are trying to help patients in the best way possible. So I feel this is the best way. If anyway you're going to take them to day 5, might as well do that before.
Okay, right. So I think lot depends on how your doctor is treating your case, and again we can say that every individual is different. And yes, if your doctor is suggesting anything for you, it should be better for you.
I would
So Fanny,
always say patients, sorry to
hmm,
interrupt you, but I
please.
would always, tell patients that trust the process, trust your doctor, trust your embryologist, because they always just want the best for you. So if you go with that kind of mindset and positivity, it will also help you in the outcome.
Right. And I think nowadays we are we are looking more for embryologist profile rather than doctor's profile. This is the fact.
Hmm.
So next we have question related to genetic screening. So at times we have seen that good blastocyst day 5 transfer, and then again the things were not coming to the proper way that we want. So is it really necessary that we can anyways, yeah, always go for genetic screening, or there are some parameters we have to follow before screening? And one more myth, Fanny, related to this, कि अगर जेनेटिक स्क्रीनिंग कर दी डॉक्टर ने, मेरे एम्ब्रियो को खराब कर देंगे, क्या सच में ऐसा है?
No, so first let me address कि जेनेटिक स्क्रीनिंग किस पेशेंट्स के लिए इम्पोर्टेंट है. ऐसा
Right.
नहीं है कि सारे पेशेंट्स को जेनेटिक स्क्रीनिंग करना जरूरी है. There are few category of patients where it's suggested कि अगर ये किया तो ये उनके लिए बेहतर होगा. So one is if you have advanced maternal age. Say if you are above 38, 39 years of age, it's advised कि आप genetic screening करो, because as the woman gets older, there are more chances of chromosomal abnormalities in the egg. तो इसके लिए सजेस्ट किया जाता है कि जेनेटिक स्क्रीनिंग करना चाहिए. Now, other group of patients who have already gone through, say, 2 or 3 IVF cycles where they have failed and the embryos have not been able to implant. So we are trying to find out more that what is wrong, why is implantation not occurring? Is it because की embryos chromosomally abnormal है इसलिए implantation नहीं हो रहा है? So these are the categories of patients which will benefit from genetic screening.
Oh,
अब बात आती है एम्ब्रियो बायोप्सी करने की. सो सी विद एवरी प्रोसीजर देर आर सम रिस्क, सो नो प्रोसीजर इज रिस्क फ्री. बट
right.
ऐसा नहीं है कि एम्ब्रियो बायोप्सी करने से एम्ब्रियो खराब हो जाएगा.
खराब.
what what we basically do when we do embryo biopsy is that ये जो मैंने आपको 2 सेल लाइंस बताई कि inner cell mass and trophoectoderm cells, so now your inner cell mass forms the baby. तो हम उसमें से कभी सेल्स नहीं निकालते हैं फॉर एम्ब्रियो बायोप्सी. एम्ब्रियो
Oh,
बायोप्सी के सेल्स निकलते हैं फ्रॉम ट्रोफोएक्टोडर्म. उसमें से भी वी टेक से 3 to 4 cells और 4 to 5 cells जो हम टेस्टिंग के लिए भेजते हैं. बाकी का एम्ब्रियो इज इंटैक्ट जस्ट एज इट इज. तो ये myth, I would urge people to not think like that embryo biopsy means कि आपका embryo खराब हो जाएगा. बिल्कुल ऐसी बात नहीं है. हम कुछ ही cells निकालते हैं, and it is, it's not a process that you just start doing. People are validated to do that process. They are trained to do that process. So उसमें से कुछ cells निकाल के फिर हम testing के लिए भेजते हैं. And
right.
then once we have the information कि ये chromosomally normal है, abnormal है, उसके बाद we only transfer chromosomally normal embryos.
Right. So next time if your doctor is suggesting you for genetic screening of the embryos, then don't worry. Doctors जो इनर मास है एम्ब्रियो है उसको कुछ नहीं करने वाले हैं, सिर्फ बाहर से थोड़ा सा, आई थिंक वी कैन से दैट, हल्का सा पिंच करेंगे और कुछ नहीं होगा. So Fanny, next we discussed this genetic screening part. Now we have various techniques, or we can say that technology is developing nowadays so much that we can see that how the embryo is growing. And at times when many clinics or many doctors, they just said कि आप देख सकते हैं वो कितने सेल ग्रोथ हो रहा है. सो इज इट रियली पॉसिबल टू सी कि हाँ भाई कितना ग्रो हो रहा है, कितना स्पीडी ग्रोथ है एंड ऑल दैट?
So now we have this technology where we have incubators in which you can basically culture embryos, और फिर आपको वो embryos को बाहर निकाल के चेक करने की जरूरत नहीं है. Every 10 minutes, that system will take a picture of the embryo, and at the end of say 5 days or 6 days of culture, एक पूरा वीडियो बनता है कि अच्छा ये एग पहले ऐसे था, फिर ऐसे उसमें फर्टिलाइजेशन अचीव हुआ, फिर इतने सेल्स डिवाइड हुए, डे 3 पे ऐसा दिख रहा था एम्ब्रियो, डे 5 पे उसका एक्सपेंशन इतना था, ग्रेड इतना था. तो नाउ इट इज पॉसिबल टू हैव दीज टेक्नोलॉजीज इन योर लैब एंड continuously monitor the culturing and development of embryos. तो ये बिल्कुल पॉसिबल है, और ये इससे आई थिंक पेशेंट्स भी काफी अच्छा फील करते हैं देख के कि ओके दिस इज हाउ माय एम्ब्रियो इज डेवलपिंग. दे गेट टू नो मोर इन्फॉर्मेशन व्हिच मेक्स देम फील satisfied कि ओके आई नो व्हाट इज हैपनिंग इनसाइड द लैब. और आजकल ये भी बहुत चला है कि बॉलीवुड मूवीज देख के देन पीपल फील कि ओ क्या हो रहा है, क्या मेरे गमीट्स ही यूज हो रहे हैं, नहीं हो रहे हैं.
Right.
So I would really want to tell patients that now science has advanced a lot. What I'm not saying कि what they are showing in the movie उसको उससे आप मत questions पूछिए और questions पूछिए, but have some trust. And at least at our fertility clinics we use electronic witnessing system. तो
Okay.
सारे जो भी स्टेप्स पेशेंट्स के होते हैं फॉर अ पर्टिकुलर साइकिल, सब कुछ इलेक्ट्रॉनिकली विटनेस होता है. ये सब कुछ एक डेटाबेस में जाता है. तो आप बिल्कुल निश्चिंत रहिए कि ऐसा कुछ नहीं हो रहा है, एंड वी आर ऑल डूइंग आवर बेस्ट टू गिव यू द बेस्ट दैट इज अवेलेबल.
Right. So, viewers, if you are in Mumbai, you can definitely meet Fanny, discuss about your embryos. And if you are not in Mumbai or any other city of India, then also you can visit at fertility clinics and get yourself checked with one of the bestest experts in India. So, Fanny, latest technologies, or I would say that many, almost all clinics in Dubai and all that, they are using laser hedging, but in India, laser hatching is limited to certain areas or certain parts. So, what exactly is this laser hatching?
सो बेसिकली क्या होता है कि जब हम एम्ब्रियोज को फ्रीज करते हैं, अगर हमने एम्ब्रियोज को उस स्टेज पे फ्रीज किया है जब वो पूरे एक्सपैंडेड नहीं है, तो
Mm-hmm.
उनका जो आउटर कवरिंग होता है विच इज कॉल्ड द जोना, वो थोड़ा सा कभी कभी फ्रीजिंग के बाद थिक हो सकता है. तो दीज
Oh,
आर द केसेस कि उसमें अगर हमने लेजर से वो जोना में थोड़े से होल्स बना दिए ताकि वो एम्ब्रियो अंदर से हैच हो सकता है. सो बेसिकली व्हेन एन एम्ब्रियो हैज टू इम्प्लांट इन द यूटरस, इट हैज टू कम आउट ऑफ दिस कवरिंग एंड देन इम्प्लांट. सो कुछ केसेस में जब ऐसे फ्रीजिंग किया है जब वो पूरे एक्सपैंडेड नहीं थे या वो कवरिंग थोड़ा सा थिक था, उस
mm.
केसेस में आफ्टर थॉइंग द एम्ब्रियो you can then use laser and bore some holes in that zona ताकि वो एम्ब्रियो आसानी से जोना से बाहर निकल सके. सो इट्स नॉट
Okay.
दैट कि हर केस में ब्लैंकेट करना चाहिए असिस्टेंट हैचिंग. इट डिपेंड्स कि आपने किस स्टेज पे एम्ब्रियोज को फ्रीज किया है, जब उनको थॉ किया वो कैसे लग रहे हैं. अगर उसका कवरिंग थिक है तो आप कर सकते हैं, but it's
Okay.
not for all cases. And this is what it helps, and basically it helps the embryo to hatch, which will
Okay.
then aid implantation.
Right. And whenever we go for this day 5 transfer, so usually there are higher chances of pregnancies. बट फिर भी कई बार केसेस ऐसे होते हैं कि आपके एम्ब्रियोज बहुत अच्छे थे और वी एज अ पेशेंट इंसिस्ट नहीं डॉक्टर आप जेनेटिक स्क्रीनिंग कर दीजिए एंड डॉक्टर इंसिस्ट कि नहीं नहीं कोई जरूरत नहीं है. तो ऐसा कोई केस आपके पास आया हो और आपने सोचा हो कि नहीं भाई कुछ तो करना पड़ेगा?
See, like I said कि अगर पहला ही cycle है वो patient का, and if the patient is not very old, then
हम्म.
usually doctors will not suggest that you go for this. If you have good grade embryos, then you transfer them. Now, if an embryo doesn't implant, say the lining was also good, uterus was conducive and receptive, the embryo was also good, but फिर भी implantation नहीं achieve हुआ, then we think of these add-on procedures कि what more can we do to make this cycle successful for the patient. So one is definitely genetic screening of embryos. The second is something known as a receptivity test, endometrial receptivity test, wherein they then take some cells from the endometrium and they send that for testing to see कि आपका endometrium exactly कौन से time पे receptive है. ऐसे
ओ,
कुछ पेशेंट्स हो सकते हैं जिनका जो नॉर्मल विंडो ऑफ इम्प्लांटेशन है वो थोड़ा सा शिफ्टेड है, कि अच्छा ये टाइम के पहले ट्रांसफर करना चाहिए या ये टाइम के बाद ट्रांसफर करना चाहिए, दैट इज व्हेन द यूट्रस इज रिसेप्टिव. So these are some add-on procedures that we offer when we feel the patient will benefit from them. But first cycle में ही ये सब करना is not always necessary.
right. And like freezing, we all know कि now we have very good freezing conditions and labs are really very, we can say that very technology wise, each and every lab is good. But again, embryos को हम कितने सालों तक या कितने years तक, how long we can freeze them?
Okay, so theoretically हम काफी टाइम तक इनको रख सकते हैं बिकॉज दे आर ऑल फ्रोजन इन लिक्विड नाइट्रोजन एट -196 डिग्रीज सेल्सियस.
Hmm.
तो उनको कुछ होने का ऐसा पॉसिबिलिटी नहीं है. बट नाउ दैट वी नो दैट दिस होल इंडस्ट्री इज नाउ बीइंग regulated by the law, and now what the law says that we cannot store embryos for more than 10 years. So now that is the limit to which we can store the embryos inside the IVF lab. Theoretically, nothing will happen to them, but
कुछ
now we
नहीं.
are all abided by the law and we have to
Right.
follow what is written in the law. So now we can keep it for 10 years.
10 years. एंड आई थिंक 10 years भी बहुत ज़्यादा है, बिकॉज इफ अगर हमें लगता है कि एक आईवीएफ साइकिल सक्सेस हो गया एंड वी रियली वांट टू कंटिन्यू आवर फैमिली, देन ऑब्वियसली विद इन 10 years वी कैन डेफिनेटली गो फॉर सेकेंड
Correct,
ट्रांसफर. अच्छा, और
correct.
अगर ट्रांसफर मैंने नहीं लिया, मेरे एम्ब्रियोज फ्रोजन है, तो 10 साल के बाद उसका क्या होगा?
10 साल के बाद we will have to contact the patient, tell them that their period is over,
हम्म.
get them to sign a discard consent, and then we
ओके.
will have to discard those embryos.
ओके, राइट, राइट. सो ऐसा मत सोचिए कि आपके एम्ब्रियोज को कुछ हो जाएगा, उनको टेक्निकली डिस्कार्ड किया
Oh,
जाएगा.
correct.
राइट. So okay, so one thing here is that usually when see we have many cases where husband is abroad or lady is going for IVF cycle and हमारे पास husband के frozen sample है. So is it a myth या ये रियलिटी है कि फ्रोजन सैंपल्स जो हैं, स्पर्म, स्पेशली स्पर्म के फ्रोजन सैंपल, दे आर नॉट गुड इनफ व्हेन वी आर टॉकिंग अबाउट द मेकिंग ऑफ एम्ब्रियोज? फ्रेश स्पर्म सैंपल इज ऑलवेज बेटर देन फ्रोजन वन, ऐसा है क्या?
See, now, like you said, it is good to have a fresh sample, because frozen sample में ऐसा नहीं है कि जितने sperms आपने freeze किए सारे ही survive करेंगे. 50 to 60% chance होता है of survival post thaw, but that doesn't mean that we cannot do a cycle with frozen sperms, because जितने भी patients हमारे पास आते हैं सबका एक sample हम freeze करके रखते हैं. Now that is a backup sample. Say on the day of egg retrieval, something happens, the husband cannot make it, or because of the stressful situation, they are not able to give us a sample. We always have a backup. And the reason we keep the frozen sample as a backup so that if needed, we can use it. So it's not that we cannot use frozen sample and cannot achieve fertilization with that. ऐसे भी बहुत cases हमने किए हैं, उसमें भी बहुत सक्सेसफुल ब्लास्टोसिस बने हैं, प्रेगनेंसीज आई हैं. सो दिस इट्स नॉट कि वी कैन नॉट यूज दैट. yes will it be better if they can make it on that day? 100% it will be better, but ऐसा नहीं है that we cannot use it. So ऐसे nothing to stress about that, oh because we have done this now our cycle will be not successful. That's not true.
Right. And we just discussed about this age factor. So we all know that after 35, there's something going to happen inside our reproductive system, और ovaries तो बिल्कुल कमाल कर देंगी, वो पता नहीं सो जाएंगी कि दोबारा उठेंगी कि नहीं. So the what you suggest, क्या seriously में एक panic button दबा देना चाहिए when we reach 35, or we can say that yes, 2-3 more years are there for us?
सो नहीं, पैनिक बिल्कुल नहीं करना है. But yes, it is definitely better if you plan pregnancy before the age of 35. Like I said, the older you get, the more chances of abnormal embryos, ovaries, ka reserve. Now imagine that ovary reserve is like a seed that we
Hmm.
start with. It keeps, getting smaller and smaller as you age. So it is better to do it before 35 years, but ऐसा नहीं है कि after 35 years you will not get pregnant. All your chances are gone. There are still chances, and that's why we're all here, trying to do the best. But from 35 to 39 years, your chances will be lesser than what it will be before 35 years of age. But it's not that you will now not get pregnant. There is still hope. And like I say, I tell patients also that, when you try naturally also, it's not that in the first attempt you will get pregnant. There is no guarantee. So if you have one failed IVF cycle, don't be disheartened. Don't lose hope. There is still time for you to try for another one. And the more you try, the better your chance. So naturally भी ऐसे नहीं हो सकता है कि first attempt में it will happen. So same with IVF. We're trying to do our best, but it's not that we can give you a guarantee that the first time you try for an IVF cycle, you will be pregnant.
राइट। आई थिंक सबसे बड़ा गेम ही यहाँ पे गारंटी का है, बिकॉज नोबडी कैन गिव गारंटी एंड
True.
एट टाइम्स वी आल्सो हैव कॉल्स एंड सबसे पहले लोग यही बोलते हैं कि मैम गारंटी दे दीजिए। सो आई थिंक हम में से कोई भी इस चीज के लिए गारंटी नहीं दे सकता। एंड सिंपल थिंग इज, अगर गारंटी होती तो हम सबसे पहले खुद के लिए गारंटी देते कि यस वी कैन डू इट। सो व्यूअर्स,
Okay.
कभी भी जब आप डॉक्टर विजिट करते हैं और व्हेन यू आर सिंपली जस्ट एंटरिंग द गेट ऑफ एनी फर्टिलिटी सेंटर, we always suggest that please do look out for your embryologist. It is good to talk things about your embryos with embryologist. ऐसा कुछ नहीं है कि आप डॉक्टर से पूछेंगे तो वो आपको मना कर देगा, but with all doubts and everything in your mind, it's not good to proceed further with your treatment. आज हमने यहाँ पे एम्ब्रियोलॉजिस्ट से बात करके देखा कि चीजें बहुत छोटी हैं, बट शायद हम उनको सोच सोच के बहुत बड़ा कर देते हैं। And again, day 3, day 5, let your doctor or your embryologist suggest you and decide for you. And ऐसा नहीं है कि हमेशा डे 5 प्रेगनेंसीज ही वाइबल रहती हैं, डे 3 भी रहती हैं। सो डोंट पुश योरसेल्फ unnecessarily towards that day 5 transfer. So if any interesting case or anything you want to discuss on this platform, so that viewers will think कि yes, अब तो हमने सब कुछ पता कर लिया एम्ब्रियोज के बारे में, नाउ गो फॉर इट।
सो बेसिकली ऐसे भी केसेस आए हैं हमारे पास जिसमें स्पर्म्स बहुत कम है. वी हैव ट्राइड टू सर्जिकली रिट्रीव स्पर्म्स एंड देन डू द साइकिल फॉर दीज पेशेंट्स. एंड सपोज अभी बहुत सारे एग्स में से सिर्फ एक ही एम्ब्रियो बना, तो पेशेंट डिसहार्टन हो जाते हैं कि अच्छा एक ही बना. बट इवन इन दीज केसेस व्हेन वी हैव ट्रांसफर्ड दीज एम्ब्रियोज, वी हैव स्टिल अचीव्ड प्रेगनेंसीज. एंड ऐसा नहीं है कि सिर्फ ए या बी ग्रेड के एम्ब्रियोज ट्रांसफर किए तो ही प्रेगनेंसी होगी. सी ग्रेड एम्ब्रियोज का भी चांस होता है प्रेगनेंसी का. सो आई वुड जस्ट सजेस्ट दैट go with a very positive outlook and mindset. Don't compare your IVF journey with other patients' IVF journey. Believe in your journey, trust in your doctors and your embryologist, and we all are just trying to do what is best for you. So if you go with that outlook, it will really help. That will be my urge to all the patients.
Right. So Fanny, we just have one query over here. uh, I would like to take that. Is only one embryo transfer is more successful, or any number of embryo transfer is successful?
So usually हम suggest करते हैं कि one or two embryos. Don't transfer more than two embryos. And now, like I said, we are all abided by the law. Even the law says that more than three embryos should not be transferred back into the uterus. Now, I feel ये बहुत personal choice है. हाँ, अगर आपने दो embryo transfer किए, chances of pregnancy will be higher as against one embryo transfer. But this also means कि then you have to be ready for twin pregnancy if we transfer to embryos. Suppose if both embryos implant, then ये एक पेशेंट का पर्सनल कॉल है कि आपको एक ही ट्रांसफर करना है या दो ट्रांसफर करना है. कुछ ऐसे केसेस होते हैं जिसमें मेडिकली इंडिकेटेड होता है कि एक ही ट्रांसफर करें, basis the uterus and what the doctor sees. So, if medically you are advised to transfer only one embryo, better to transfer only one. But otherwise, this is a very personal call whether you want to have one or two. If you will transfer two embryos, chances will be higher than one. But everything comes with its own pros and cons. So, if you transfer two, then it's possible that you can have a twin pregnancy.
So, even we can say that age is also the deciding factor, like कि एक embryo transfer करना है या दो. So, can we say that age is also the deciding factor in this?
Yeah, see, with suppose you are 39 years old or 40 years old, there is a possibility that there can be some complications with pregnancy with age.
Hmm.
But ऐसे blanket नहीं बोलेंगे कि अगर आपका इतना एज है तो एक ही करना चाहिए. Maybe in some cases it will be advisable to do one,
Hmm.
but it's not that we can only do one if you are above this age.
ओके राइट एंड आई थिंक अगर आपका कुछ भी और क्वेश्चन रह गया है सो यू कैन जस्ट मैसेज अस वील कनेक्ट यू डायरेक्टली विद द फेनी एंड इन केस you want that immediate connection or you want to visit her, please do let us know, or we have the appointment number on the comment section. Please do call, book an appointment. बस appointment book करते हुए do mention fertility dost on that platform. So thank you, Fanny. Thank you so much for joining. It's really wonderful having you on this platform. And I can say that youngest doctor on our platform finally.
Thank
So
you so much. It was a pleasure having this conversation with you.
thank you. Bye bye.
Thank you. Bye.